Alrighty, so here we are, a new year. A lot of us are thinking about starting anew when it comes to our health.
Yeah, in order to do that, you may have a few health-related questions. After all, knowledge is power, and who better to answer those questions than PRMC's Chief Informatics Officer and hospitalist, Dr. Chris Snyder. There you go with your your elbow bump. Love it. Okay, so Happy New Year.
You also.
Thank you so much. So some people have made the resolution to live a healthier lifestyle. That's kind of a broad resolution. So where do you think is the best place to start?
Typically in the kitchen. Cabinets, looking in those areas. You know, I push a lot of folks to try to be a little more transparent with their behaviors, and that's probably one of our biggest challenges, I think, when we take histories from folks, is just being honest with yourself about what you're putting in yourself. So food is probably the #1 area where we all kind of lose control, and transparency around that, I think, is really super important, and understanding your inventory.
Right.
If you look at your inventory, guess what? You're going to look at changing your inventory if you're looking to improve. So I always push people to nutrition, because that's probably one of the biggest things you have control. Exercise, maybe not so much if you're hurting or arthritis or whatever's going on, but nutrition we can all control a little bit better than the average individual.
So read the label a little more and know what you're putting in. And all right. So in general, do you think there's some new habits that we could pick up other than nutrition that would?
Yeah, I think just planning on doing something physical every day,
right.
Getting out from behind the couch, or sitting on the couch as we are, but getting out and doing something physical, absolutely. You know, push yourself a little bit. Getting into a group too is always good. Make new friends who like to do those things, and because friends push you. Again, back to that transparency. It's not very easy to be transparent with yourself. Well, actually it is, but it's not. You know what I mean? So getting into group fitness, group exercise, group diet, all those things really encourage folks to be honest with what they're doing on a day-to-day, and share your weight. Yeah, how much you weigh?
But not today.
Not today. Not
Okay.
today.
We actually have a question from a viewer here. I caught a cold just before Christmas. Most of the symptoms are gone except coughing, and it's still a productive cough, meaning still coughing the gunk up. Should I be worried? Also, what type of cough medicine should I take? The kind that suppresses the cough, or the kind that, I guess, gets all that mucus out? Right,
yeah, the first part of the question, that irritability, when you sprain your ankle, it takes about 6 weeks for the ankle to heal. That inflammation that occurs in that joint is similar to any other inflammation. When you get a cold, it causes inflammation. So coughs can persist for quite a while. That's probably your last symptom besides the runny nose. Runny nose, sore throat goes away after all that, but that runny nose persists and persists and persists, and it makes you cough. There's a lot of reasons for cough, so if it is persistent, you know, beyond a couple weeks after you've had something, it's probably a good idea to get somebody to listen to your lungs, make sure you're not dealing with asthma or something a little more severe. As far as cough suppressants go, I'm not a fan. Cough's Mother Nature's way of clearing things. In fact, in the hospital, I really avoid that. We have some folks who cough so much, you have to do it because of broken ribs, et cetera, associated from it. So it can get that severe. So there are particular instances where using cough suppressants are important, but for the average cold, it's good to cough, and the expectorant is probably the better one of the two, because you want to break up that mucus, drink plenty of fluids to make sure you break up that mucus and make it nice and thin. So when you do cough, you get rid of that bad stuff.
Okay. Some doctors at walk-in medical facilities give patients who have a cold or virus a steroid shot to help them start to feel better quickly. What does that shot do, and is it ideal?
Yeah, so steroids are an anti-inflammatory. So as I just described, inflammation is the reason you feel cruddy. That's why your throat gets sore and everything else. As long as it's not a bacterial infection. The viral infections do cause a fairly rapid inflammatory response that creates the cough and all that junk. So the steroids do help quickly resolve that. They're short acting though. They only last for a short period of time. Some people, that may be enough to push them over the edge to improvement. That may also be enough to aggravate some things too. If you're a diabetic, et cetera, you don't want to use those drugs. So, but the providers that use that, it does have a great symptomatic relief, and it is very helpful from that perspective.
All right, let's talk about the cold. We have a viewer who sent us a picture, and she says this happens to her all the time. If you take a look at the picture, you can see her one finger is white. It looks like all the blood is drained and everything else is normal, and it happens when it's cold.
Yeah, there's a bunch of diseases that can cause this. There's some challenges with that. So it can be a vascular disease called vasculitis is the big word, which is inflammation of the blood vessels. Some people also can get rashes that look like that too. I would definitely want to do some lab work on this individual and evaluate their inflammatory process going on in their body. Typically, slowly warming that joint will help the rest of the hand to resolve itself. Some of those get pretty severe though, and can be obviously painful looking, as you saw there.
Yeah.
So there's a disease called Raynaud's, which a lot of folks have, and that's usually also a inflammatory. We're not quite sure what causes Raynaud's,
right.
but it is an inflammatory response of the vessels, probably.
How
My
about
wife's got that.
Yeah. All right.
Those
Doctor,
are-
thank you.
You're welcome.